this computer.
Hi, welcome everyone. Thanks for joining us. My name's Sam. I'm a massage therapist, a remedial massage therapist based in Glasgow. I specialise in women's health, in particular pre and postnatal, and wanted to talk today a little bit about what traumatic birth experiences are and how the three-step rewind technique can help. Okay, so with me today is the lovely Alex Heath. Alex is a clinical hypnotherapist based down in London. And I met Alex coming up to nearly a year ago when she came up to Glasgow to deliver a course on the rewind technique for traumatic birth recovery. And I was absolutely blown away by this course. It's very simple and very effective. So I wanted to bring Alex on today just to help you understand what a traumatic birth experience is, how you can recognize the symptoms, and how there is help available for you out there. Alex, did you want to add anything to that?
No, thank you for the lovely introduction and for giving me the opportunity to talk about something that I love talking about. So thank you very much.
Yes, now I have to add, Alex is very passionate about her work and sort of specialises a lot in birth work, and this came across very much on the course. So within the course, there was practitioners from all sort of walks of life, people like myself who, principally a massage therapist, but also sort of NHS practitioners, private birth practitioners. So, the work she does extends across a huge range of people, and so we can benefit a lot of people. So Alex, let's dive in with sort of the first thing I wanted to talk about, and that's really the crux of what a traumatic birth experience is. We know that obviously this birth experience can happen anywhere along the journey, sort of within sort of pregnancy, the actual birth itself, postnatally, maybe even a sort of breastfeeding experience, and can affect not just the women having the birth experience, but the partners, the men, the birthing partners, the doulas, and the midwives as well. However, I really wanted to talk about this word trauma, because it's a very extreme word. It's a word which tends to happen to other people, not to ourselves. And it's a word we tend to associate with, very, very negative things like war zone, and not with something which should be the most joyous thing in the world that happens every day and a natural experience like birth. So how does someone know that the experience they've had, which may have negative feelings towards, is actually a traumatic experience? So what kind of symptoms would they look out for? How does it present themselves? How do they know that they would need some intervention?
Well, I think it's a really, really good question, Sam, and I think you're absolutely right. The word trauma for a lot of people who are perhaps struggling or with feelings that they would rather not have, would just be more inclined to think, oh no, that's not me. I might have had a long labour, but it wasn't traumatic. However, it's worth pointing out that over 30% of all parents will describe their birth as traumatic, but there is probably an even larger number who are trying to sort of, underplay what they're experiencing and diminish the kind of impact of what they're experiencing. Maybe because they simply aren't allowed the space within their family or friends to explore and acknowledge what's happened and the impact it's had on them. Culturally, we're not very good at doing that. So very often people aren't given the space and the time to be able to kind of say, actually, that was really difficult for me. I really struggled with that, and I still think about it often, or it still hurts me in some way, or I still get upset about it, or I feel so strongly that I never want to talk, those kinds of things. So in my work, my process of working, when somebody comes to see me for hypnotherapy, whether it's because they have feelings that they're finding very difficult, or because they have ways of responding or behaviour that's not serving them, my first question is always to seek to understand how they got to that point, and that very quickly reveals a starting point, and in that also reveals that there was a time before then when they didn't feel that way. And so most of the time, the people that I'm seeing recognise on some level that they didn't used to feel this way, and that they didn't used to have these ways of responding. So we talk about trauma, but actually I kind of just feel that that all of us, as part of our life experience, will go through some very difficult and very stressful life events. That's just part of life. And depending on how strong and resilient or how vulnerable we might be feeling at the time, those events may affect us differently. Okay. And from that, we might still continue to hold those events within our bodies and within our minds in ways that cause unhelpful symptoms and ways of responding. So I have a much more fluid way of thinking about trauma. For me, trauma isn't just about near-death experiences. It's really much more in the eye of the beholder, and it's more about an experience that was frightening, where a person felt they had a loss of control, and that was, that they were unable to escape, perhaps. Those are the kind of ingredients that I'm thinking of. I don't know, does that make sense? I don't know if I've explained myself at all well.
No, absolutely. And actually, it's now sort of allowing me to remember something that you talked about on the course, where we need to think of these experiences as having an injury to the mind. You might injure the body, and you would go to the doctors, and you would, seek a way to make that injury better. But when we injure our mind, we tend not to do that, or tend not to even recognise that it's been injured. So, we all go through really bad times.
Yeah.
And we have to recognise that might have injured our mind, and we need to then just fix that injury. You don't just let something, fester away, if it's an open wound. So why would you do that with your brain?
I think that the key for a person recognising or acknowledging that something that happened in the past is still affecting them is if they still think about it a lot, if it still goes over in their mind, or if they find themselves re-triggered by it still. So if a person re-triggers them, or if a place, or even if a sound or a noise or a word re-triggers them, then that's a sign that, and if they are dealing with those recurrent thoughts or re-triggering nature of things in a way that's not helpful, or indeed if they're avoiding everything, if they're going to a lot of effort to kind of avoid any reminders or any talking or any mention of it, this kind of real repression, and this refusal to feel can create a numbness in a person towards everything. So those are the kinds of symptoms that we're commonly thinking about when we're talking about the word trauma, and it really plays out in a person as a level of high anxiety. There's a real sort of tension in the body, which is where you're probably seeing people with physical manifestations of that anxiety and that hypervigilance and that sometimes anger, sometimes sadness, sometimes a feeling of hopelessness. But all of these feelings and symptoms, if they're still carrying on long after what happened has passed, then that's when people usually go, do you know what? actually this has affected me, this is still impacting on my life. And is what tends to happen then is that people, if they're not seeking help professionally with either, you know, in a way that suits them, either with a massage therapist or with a hypnotherapist or whoever it might be, then, you know, people are more inclined to find coping mechanisms in alcohol or addictions or eating or, you know, OCD, or that, you know, or they get dragged down into depression, because those feelings of high anxiety on a day-to-day basis are very stressful and are quite hard to deal with. So that's the connection there between the symptoms and the more serious mental health issue.
Yes, and I think it's very key to note that if you are living on a day-to-day basis with high anxiety, you know, the stress hormones associated that will increase. You know, you have increased adrenaline, increased cortisol, and that is not good for your body on a physical level. You know, we tend to think about more mentally, but actually physically, you will suffer. You know, and the repercussions are quite phenomenal. You know, on long-term chronic sort of adrenal fatigue.
So, yeah, and I see a lot of women who actually who had perhaps a traumatic birth experience the first time, and they had just got on with their lives and they'd recovered and they were over it. And it's when they're pregnant again or thinking about getting pregnant again that they're massively re-triggered and their body's flooded with the cortisol and adrenaline that you're talking about through fear and anxiety, because that's what the body produces when it's afraid, is huge amounts of cortisol. And that is very unhelpful to a woman who's pregnant. It's unhelpful to the pregnancy, it's unhelpful to her, and it's massively unhelpful when planning for a better birth next time. So it really stands in the way of that. So that's kind of how I ended up working very much more specifically with perinatal trauma, because the hormones that are created by that level of anxiety are a real hindrance to being able to experience birth and pregnancy in a way that you would choose, you know, if you could choose.
Be optimal for your exactly. And the baby's health.
Well, and for you as well.
Yeah, and I think, you know, that's very interesting, because actually, you know, in my short career of being able to be a rewired practitioner, I found that all the clients that I've had have been pregnant subsequently and have got to that critical point of now having to really deal with the issue of a previous traumatic experience. And this baggage is just sitting in the way as a barrier of not allowing them to move forward to think about this pregnancy in a healthy, clear-minded way.
Yeah, absolutely. And that's why it's actually, I think for many of us, and I'll even include myself in that, you know, I've gone through things in my life that I haven't addressed through therapy or whatever, and you get through and whatever, and eventually something resolves or breaks or moves or shifts or whatever it is. But actually, when someone's pregnant and they are, approaching the thing that they're really afraid of is getting nearer and nearer every day, it becomes very intolerable for a person. And so, you know, people really feel that they have no choice but to seek a resolution, because it's literally, for many people, that's like staring down at an abyss, because it's in some cases akin to a phobia, you know, in that.
Yeah, it's a make or break situation. And I think it's only human nature that we tend to put off these until it really gets to that situation where you even need to
which is a shame, but I think absolutely, I'll hold my hand up and say that I've been guilty of that in the past. I hope not so much now, but you know, that is human nature, I think, because we've got lives to lead, we've got families to care for, there's lots of stuff going on. But I think the people that I see that do make it to the therapy room, who do make it to sit in front of me, are people who've gone, no, I didn't always feel this way, and I'd like to feel the way I felt before that thing happened.
And that's a really lovely way of describing it. I think that's, you know, it is so hard to know whether you are suffering from a traumatic experience or whether this is just your new postnatal life with
Very
children.
much so, definitely.
But this lovely thing of like, actually, I'm not the person I was before,
Yeah.
and you should be. It's regaining, the person you were,
Yeah.
not just for yourself, but for the people around you. To be the parent you want to be.
Yeah, exactly. And to be able to enjoy parenthood and to be able to thrive into it rather than to survive. And I think that that's what a lot of parents kind of find themselves doing is that they're, after a traumatic, difficult perinatal event. And as I said, it doesn't need to be birth. It could be poor postnatal care, or it could be any one of a number of things. Difficult breastfeeding experiences and so on. All do have an effect, and can just leave. You need so much strength to be able to parent an infant, a young baby. It's really, really can be really, really tough. So struggling to recover from something that was difficult as well is like a double whammy, because again, we are thrown into survival mode, whereas actually we need the hormones of love to be able to make that job easier, to facilitate bonding and sleeping and all of the things that kind of make parenting, a good experience.
Yes, yeah. Something we talked about actually before we came on was, what can often trigger the traumatic birth experience is this loss of control during the birthing process. Would you kind of touch a little bit on that? Because actually most of the ladies I've talked to, this is probably the biggie for them.
Yeah, absolutely. I think it is really, really common because of the way that we birth in the modern world. For many, it will be a very medicalized experience unless they make a conscious decision to say no to that and to plan for something that's very different, and to take back control. So it's really unfortunate. And I think that that's what a lot of first-time parents get caught up in. They simply have no idea that the current state of play does mean a very industrialized, processed package of care that very often treats parents like sausages in a sausage factory. And that's really difficult for many people, naturally so. And I think I know many, many midwives who feel that that's not acceptable either. But it's a state of play because of years of underfunding, lack of staffing levels, and many more issues as well. So I think simply a lot of first-time parents are unaware. So education is vital for first-time parents to kind of be able to plan and ask for. I would say that's the most important thing, is ask for what you need, rather than thinking that you have to do what you're told to do, because it's your body, it's your health, and you're going to have to be the one that lives with that long term.
Yeah, absolutely. I would just like to add that I've had lots of clients who've had amazing births.
Yes, yeah. I had amazing births. No, absolutely. And I say none of that in any way to frighten people or but actually going in unprepared. No, I'm not saying it always leads to a bad experience, but it kind of, if you don't know what you want, then you are quite vulnerable to that process.
Yes.
And that's quite frightening when you're you're giving birth. So education is key.
Yeah, it becomes something which just happens to you rather than being something you're actively.
Exactly. Yeah.
Despite the fact that it's your body having the contractions and
exactly. Yeah, it can be. Yeah, sure.
For those people watching who maybe want to know a bit about the science behind how the technique works or what's happening with our brain when we have a traumatic experience, would you be able to just give a short?
Yeah, sure. It's very, very simple neurobiology, and please don't let that word scare you. But we are designed, all of us as human beings are designed to respond to threats, and we have a part of our brain that's very primitive, called the amygdala, which is like these two little small almond-shaped bits of our brain that are right in the middle of our brain. And have been there for millennia. So they're sometimes referred to as the sort of, our caveman brain, really. And this part of our brain is responsible for activating what is known as the fight or flight system. So it's very attuned to sensing threat, sensing danger, feeling unsafe. And so when we feel unsafe in any situation, and it doesn't have to be a war zone. The idea is really that it's a perceived threat. So a perceived threat for someone could be being asked to come into a meeting with their boss and have an appraisal. That could send somebody into fight or flight. If they feel very unsafe about their job and they don't feel that their boss likes the threat, that could send them massively into fight or flight, quite reasonably so, because the perceived threat. So when this happens, the amygdala is signaling to the body to really get out, to just run or to fight. And everything else in the brain sort of shuts down. So the more rational reasoning part of the brain, this kind of higher developed brain, our prefrontal cortex, is closed down. So we're unable to logic our way out of a situation and kind of see the fine detail or the grey in it. We're kind of like, because the amygdala just wants action, take action. Now, the problem with it is that when the amygdala isn't honoured and action isn't taken, we don't run away, we don't fight our way out of the situation, the perceived threat, then the brain kind of becomes encoded with that difficult event. And this is how phobias are formed. And other kind of problematic issues is that there is a connection between this fight or flight center of the brain and the memory of it. So it becomes linked by a neural pathway. So whenever that memory is remembered, or there's an aspect of it that's re-triggered, so if you walk past the hospital again, for example, or can even sometimes be a word like push, for example, or whatever it might be, then that neural pathway sends a trigger off to the fight or flight center, the amygdala. And again, there's this rinsing, this cascading of physiological symptoms: increased heart rate, rapid increase in breath, muscle tension, the digestion is suspended, and so on. So that's the kind of physical, biological aspect of trauma. So there's an actual link in the brain that's re-triggering, and that's why for some people, they feel like they're on loop with their event. They're thinking about it all the time. Perhaps they're having nightmares or flashbacks in more extreme cases, and they're thinking about, and it's because every time they do, that pathway between the fight or flight center and the memory is growing stronger, and the amygdala is in this state of, it's permanently on. So it needs to be discharged, which is why things like massage, yoga, exercise, relaxation or mindfulness are brilliant, because they will just turn down that hyper aroused amygdala. It's like it's being left on, and it's constantly being re-triggered and re-triggered. So it needs to be turned down so someone can feel, even just for a short period of time, relief from that always being on, that ever charged sense. And when somebody is able to relax and turn down those levels of arousal, then there's an opportunity to work with the memory in a way that it can disconnect from that trigger. The trigger can be broken, and the memory can be free to go off. So the person's then got some space, sort of emotionally and mentally, to begin sort of reprogramming those responses to begin to feel better.
Yes, yeah. And you make it sound so simple, but actually it is.
I don't like complicated things.
It's the beauty of it, and this is what really got to me on the course, was that something so powerful could have such a beneficial response. And as you touched upon, I see it all the time in my clients as a massage therapist. They come in and that their body is holding on to this trauma. And I've listened to webinars where they literally say that because in this traumatic experience, say you have got the fight or flight option, and they can't do either.
Can't do it either, yeah.
That trauma literally gets frozen in the muscle memory. So it stays there until it can be released. So, very, very much this is both a mind and body approach.
It is, definitely.
Yeah,
and so that's why it's a great tool for massage therapists, actually, because they obviously have a very physical way of reducing and turning down that level of hyperarousal that then gives that opportunity to work with the memory. But that's the problem, is being always on the whole time. It does have a cost to our overall health.
Yeah. Fantastic. Right, Alex, anything else we want to add? Anything else we want to cover?
No, thank you for giving me the opportunity. I suppose the only thing that I think is the biggest barrier for people receiving or seeking help is really, first of all, an acknowledgement that they need it.
Yes.
And that's the first thing, is really a person really thinking, actually, if I'm honest, what happened then still does affect me now. And I wish that wasn't the case, because if you do think you are someone who acknowledges that the way they feel or respond, or the way that their day-to-day life is impacted, is still going on from something that happened in the past, then here is a way of working that is very gentle, very fast and very effective, that can give you the space and opportunity to feel peaceful once again. And when we're in that state of peace and calm, then you can do all sorts of things.
Yes, absolutely. And and it doesn't have to be a recent experience.
No.
You could be 10 years down the line and just realizing that actually there's still a lot of stuff going on.
Yeah, for sure. Yeah, definitely. Because that's life. And we're not saying here that actually it's wrong to have heavy feelings. It isn't. Like, it's very appropriate for people who have gone through a difficult experience to feel grief and to feel loss. But just that if that remains long term and it's still affecting you, then you might want to do something about it. Yeah.
Yes. What's the timescale that we should be looking at in terms of, hang on, these feelings aren't going, maybe I do need some extra help?
Yeah, I mean, I think from a best practice point of view, if somebody's just had a baby, then certainly sort of saying a watchful waiting period of 2 months is a good idea.
Yeah.
And really during that time to ask for more support. So ask for more support from friends and family, and to draft it in from professionals if necessary, if you find that you are somebody who's struggling with those kind of trauma symptoms that we were talking about. And really giving yourself a time and space every day to turn down that level of arousal, which I know can be so difficult if you have a newborn baby. That is tough. I won't say it. But again, if you're able to turn down those levels of arousal, turn down that permanently on amygdala, then some of that feeling can be discharged and you can recover more easily. But if you still find long term, after a few months, that that's really getting in the way, and that those symptoms are still bugging you every day, and they're still really dragging you down to places that you wish you weren't going, then certainly it's definitely worth seeking appropriate trauma therapy, for sure.
Yeah. I think it's often that realization that these feelings are now becoming the norm.
Yeah.
Recognizing that you don't want that to be the norm.
Yeah, exactly. Because what happens is we all naturally just find ways of coping. So we'll just avoid it. So, I mean, for example, I know lots of people who just simply said, well, I won't have any more children. I just won't do it again.
Yes.
And that's very sad, but completely understandable given what they went through.
Yeah. Well, Alex, thank you so much for being with me today and discussing this very sensitive but very important topic. Where can people find you if they want to maybe check out your hypnotherapy or?
Well, they can definitely look on my website, which has more about the TBR three-step rewind technique, which is a step-by-step process that's usually delivered over 3 sessions. So it is very fast and very quick. All of the professionals that I have trained who have experience are on the website there as listed as practitioners. Many of them have additional skills. Yeah, including yourself, and many have additional skills. So some are massage therapists, some are doulas, some are hypnobirthing teachers, some are midwives. So if you're somebody who kind of thinks, well, I'm pregnant and I would really like that, or I'm this and I'd really, then that's a perfect way of working with somebody. So that website is www.traumaticbirthrecovery.com, and you can read more about the 3 steps and find a practitioner near you if you think that sounds like something that could help you.
Perfect. That's brilliant, Alex. Thank you so much.
No problem. Thank you for the opportunity.